Thanks everybody for joining in today's Pediatric Tech Talk. My name is MG Finn. I am the Chief Scientific Officer of the Pediatric Innovation Network and former co-lead of the Pediatric Technology Center. And I'm filling in today for Leanne West, who is traveling, and I and Leanne and everybody are just thrilled that we have Lindsey Bullinger here. Lindsey, thank you so much for agreeing to spend some time with us. Just so that everybody knows, we usually go about 25 minutes to half an hour, and there will be opportunity at the end for the attendees to ask questions, which you can type into the chat, and the chat or the Q&A, and I will read them and try to shepherd that along. So Lindsey Bullinger is here. She is currently assistant professor in the School of Public Policy at Georgia Tech. She came with training as a Master's of Public Administration from the Maxwell School of Citizenship and Public Affairs at Syracuse University, and then her PhD at the O'Neill School of Public and Environmental Affairs at Indiana University. She is as well a faculty affiliate with the Children's Pediatric Research Alliance at Children's Healthcare of Atlanta, with whom we work very closely, and the Georgia Tech Center for Health and Humanitarian Systems, and the Wilson Sheehan Lab for Economic Opportunities at the University of Notre Dame. Her research examines how public policies affect child and family health and well-being, especially among low-income families. And I took a delightful tour yesterday through some of her published papers. I just want to read you a few titles because this is just phenomenally important and timely and interesting work. Paid Family Leave, an upstream intervention to prevent family violence. The impact of state Medicaid eligibility and benefits policy on neonatal abstinence syndrome hospitalizations. Effects of universal and unconditional cash transfers on child abuse and neglect. Home but left alone, time at home and child abuse and neglect during COVID-19. And Uber and family violence. Just a terrific intersection of policy, current societal trends, and human and pediatric health. So, Lindsey, with that long introduction, thank you again for being with us. Let me start by asking, tell us a bit about your research in general and how you arrived at these areas of interest.
Sure. So thanks so much for having me, first of all. When I first started getting interested in this space was actually when I was in high school. I was a math tutor for some students, elementary school students, and one thing that I noticed in high school was some of the students would come fully capable and prepared to think and talk about math, and some other students came and could not sit there and think and talk about math. And I started to really think about why. Why was this? What was different about some of these kids? And one thing that became clear to me as a young adult was that these kids were just facing very different home environments. And I sort of wonder, do I have a role in this as a math tutor, right? I was just volunteering after school. Do I have some role in this, or who has a role in this? Whose responsibility is it to get these kids on the same sort of playing field? And, a lot of teachers and education personnel understand this and feel somewhat similarly. But for me, it felt more like there was a larger role. And that was really my first line of inquiry into understanding what is the role of public policy interventions in making children thrive, and particularly in their home environments. And so I sort of found my niche in the home environment, in part because there's a lot more research in the education policy space, in the health policy space. And one thing that wasn't as well understood is what's going on at home. Now, I do, of course, have some intersections with health policy, but usually it's sort of within the context of health, the effects of health public policies on things that are going on within the home. So it started a long time ago for me. And then as I grew and developed as a graduate student, I learned that, wow, we really don't know a whole lot, at least from a scientific perspective, about how public policies and government interventions are affecting kids broadly, but particularly within their home environment. So I felt like this was an area that I could really contribute to quite meaningfully, and have tried to over the past decade.
Well, that's terrific. Thank you. Kudos to Georgia Tech for hiring somebody like you. I'm just so happy that you're here. Okay, so my next question. You're an expert on how public policies and macroeconomic factors affect child maltreatment. Can you tell us a little bit about, what we're talking about when we talk about maltreatment, or what you look into when you're talking about child maltreatment, how it's reported, and maybe some of the other factors in families' lives that correlate with maltreatment?
Sure. So child maltreatment is a very large umbrella term, and it includes physical abuse, sexual abuse, and neglect. And neglect can actually be further broken down into two different types of neglect, one being supervisory neglect, which it basically is not enough or inappropriate supervision of a child. Or it can be material neglect. And material neglect is the inadequate provision of food, clothing, shelter, medical care, or hygiene. So child maltreatment can be observed by researchers in a variety of ways. One of the more typical ways that we measure child maltreatment is through child maltreatment reports. So usually these are reports to Child Protective Services agencies that come from people who are mandated by law to report suspected child abuse and neglect. So people like teachers, medical professionals, social workers, police officers. Similarly, people will sometimes call 911 to report child abuse. This is a more common route for neighbors, family, friends, or anonymous reporters. Another way to measure maltreatment, and that's particularly relevant for this audience, and because this is more common in the medical community of maltreatment researchers, is using injuries and abuse that are seen in hospitals and medical facilities. So that's another type of data source that I'll talk a bit more about here in a little bit, I'm sure, in some of my partnerships with the Children's Healthcare of Atlanta. And so thinking about what are some of the factors in families' lives that might be predictive or correlated with child maltreatment. It's kind of tricky since there's so much, since it varies so much by different maltreatment types. So, for example, younger children tend to be more neglected, reported for neglect more than older children, but older children are more likely to be victims of sexual abuse. Children with exposure to substance abuse or family exposure to substance use disorders are also at a greater risk for maltreatment. Any source of parenting stress and social isolation can also perpetuate maltreatment risk. And then finally, financial hardship is also tightly linked with maltreatment, and this is especially relevant for the perpetration of neglect. And so are other things like community violence and exposure to housing and food insecurity and unemployment. So all of these different pieces of family life and home life can certainly play a role, and also community life as well can play a role in some of the norms and experiences that children have.
Thank you. Touching on one of the things you just mentioned at the end. So you've published a number of papers on how income support policies and money just kind of generally affects child abuse and neglect. So what have you learned? What have you and your colleagues learned from that kind of work?
Yeah, so there's been a large body of work in the last maybe 7 or so years that has shown that public policies that are supportive of income, such as higher minimum wages, more generous tax credits, more generous child support policies, all of these have been shown to reduce child maltreatment reports. One thing that my colleagues and I have tried to do is disentangle this relationship between just cash or just income versus incentives for employment. And so one of the ways that we've been doing this is by studying public programs that essentially give people, give families, give parents money without having any sort of strings attached. So, for example, one way that we did this was to pair some medical records from the Children's Healthcare of Atlanta on child abuse that's presenting to the emergency department. We paired that with disbursement of the 2021 child tax credit expansion. So basically what happened in 2021 is the child tax credit got much more generous. And it had this rollout that was very different from ever historically, the way that the child tax credit was rolled out. And so instead of just coming in at tax season, like in April time, there were these disbursements once a month of about $300. And it was nearly universal in its take up among parents. And so what we saw is in the days following disbursement of that $300 roughly child tax credit, child abuse cases that were showing up to the ED in all of our CHOA facilities, they declined substantially. It eventually returned to baseline levels. So this does signal to us some sort of immediate but short-lived effect on how just giving parents money to support some of their most basic needs, what that can do for child abuse and neglect that's presenting to the ED. So in some of my other research, my colleagues and I take a little bit longer term perspective. So this was sort of looking at like the week following disbursement. And so what we do in this project is look at whether giving people a $1,000 unconditional cash transfer can affect the likelihood of coming to the exposure of child protective system services at all. Like, if we just give parents money, are their kids less likely to show up to a caseworker in CPS? And we find that this money, an extra $1,000, reduces exposure to the child welfare system by about 10%. So the reason that this is important is because of the way that the system works right now. At present, children are removed from their homes when they are deemed to be at risk for abuse or neglect. And sometimes they're removed for poverty-related reasons, and they're put into foster homes. Okay, when they go into foster homes, the parents in those foster homes are then paid monthly stipends to care for those kids. And so we wanted to know what if we, instead of paying foster parents to take care of the kids, what if we give that money to their biological parents and then spare the family from being split up? And the answer from this line of research seems to be yes, that is effective in terms of saving the government money while also sparing those families from having to be broken up. So we think this is really important from a sort of moving the needle in the status quo of how the system is working right now.
So I want to move the discussion to COVID in a second, but let me follow up just a little bit. Do you have access to data from other systems, Europe or elsewhere in the world, for example, or perhaps other states that do things differently? Is that part of this kind of investigation, or are you really focusing on Georgia or the Southeast?
No, so my research mostly focuses on the U.S., so not exclusively Georgia or the Southeast, but I usually do look more nationwide. Data from other countries is very different. They have a completely different, most of the time they have a completely different system. For example, whenever I present to European audiences, they are just so baffled by wait, what do you mean 37% of children in the US are the subject of an investigation of Child Protective Services at some point in their childhood? That seems outrageous to them. I mean, it's outrageous to me, and I live in the United States, but when you present this kind of work to other researchers around the world, it's just very different. The systems that are in place, other places also have a more generous safety net, which sort of helps to catch some of these reports before they get into the Child Protective Services systems. Other social safety nets they look very different. And so the way that child victimization looks in other countries is also very different. I have not done any sort of comparative analysis yet around the world, but what I do know is that the U.S. system is very different from other countries around the world.
All right, thank you. So in 2020, I know that pediatricians groups and others raised the alarm because a lot of people were concerned about potential increases of child maltreatment. because of the challenges that families and communities were facing and in the pandemic, and particularly the start of the pandemic. We all kind of forget, but it was just a crazy time. So in most places, reports of child maltreatment, I think, dropped in the first couple of months in the pandemic, and then didn't. What was going on there? What have you learned from studying that period?
Yeah, so as soon as the pandemic hit, I really pivoted much of my work to try to produce policy relevant work that was going to aid policymakers immediately in terms of what to do, what policies should we be implementing to help families. And so I was very quick to turn to COVID specific work regarding child abuse and neglect. And so that first wave of the pandemic in March of 2020, it was so calamitous. It was crazy. And most people in the US were under, some sort of instructions to stay at home to reduce the spread of COVID-19. And these public health orders led to, sudden and unprecedented increase in the amount of time that people were spending literally inside their homes. And so for parents, this also it might even have been a bigger challenge that schools and daycares were closed, so they were simultaneously providing childcare and educational instruction while either having to work in person or having to work from home or getting laid off and losing that financial stability. Other sources of usual support for parents, such as visiting family and friends and houses of worship or using public services, those were also out of the question. So this left parents effectively on their own to figure out what to do. So in the context of child abuse and neglect, this meant that there were fewer eyes on children, so to speak, whether that's in the context of schools or other community resources, or in the context of parents maybe having to work while also take care of their kids. Although home is a potentially safe place to be for COVID avoidance, it could have been a very unsafe place for other reasons. But on the other hand, it's possible that parents and children were able to spend more time together, potentially reducing child abuse and neglect. What we saw universally were these huge drops in reports of child maltreatment. Some specific papers include some of my own, looking at reports in Georgia, Indiana. Others have looked at Florida, Colorado, New York City, everywhere around the world. We see this reduction in child abuse and neglect referrals. The evidence is now quite clear that this was just largely due to fewer educational personnel, fewer teachers that were making reports to CPS agencies. But it wasn't only them. It was, there were also fewer reports coming in from all different types of reporters. This drop in CPS reports, however, is maybe expected since something similar happens during school breaks, like summer and winter breaks. And an unknowing reader might say, hey, this pandemic has been great for kids. But anyone who has interacted with children would probably know better. So basically, just as an example, in April of 2020, we surveyed several providers of a child maltreatment prevention program to see if they thought that families were at a greater risk of maltreatment. And almost 90% of them said yes, families are their children are at an increased risk for maltreatment right now. And this is why it was especially important for researchers to be creative in measuring child maltreatment, because we couldn't just rely on sort of the traditional measure of child maltreatment referrals, because they were not reflecting the reality at that point in time.
Yeah, this is a problem we often deal with in experimental science, right? You see what you look for, and
Right.
if you don't have a tool to see it, it doesn't mean it isn't there. It's
Yeah.
fascinating. Um, okay, here's now perhaps a more difficult question, or perhaps a more difficult issue for us to grapple with as a society. So you and your colleagues have taken different approaches to measuring child abuse and neglect, but then you have that information, families have that information. How do you understand how families at home interact with what these measurements that you're making are showing? Like, how do you study families' response to things as they develop, as you're measuring them? This is again, in science, in laboratory science, this is not a problem. But you're dealing with much more important issues.
Yeah, so I don't know if I'd say much more important, different issues. So one thing that was very helpful early on in the pandemic is that a lot of chaos breeds innovation a lot of times, and so one thing that happened was a lot of private companies that are data collectors, basically, of things like cell phone data, app location data. They basically released all of their data for researchers for academic research purposes. And so this was a really unique opportunity for us to use cell phone tracking data and to link them at an aggregate level. We weren't violating any sort of human subjects research here, but to link aggregate cell phone tracking data on mobility and movement, and how long a phone, a mobile device, was literally staying in the same location or within sort of a very small area. And to link those with CPS reports, again at the community level. And so what we were trying to do was to see if there was this relationship between these extended periods of time, literally inside the mobile device's home, and child maltreatment reporting. And I think this is so fascinating that we found that each 15 minutes that the mobile device, which is usually attached to a person, was at home, literally in this this little box, was associated with an increase in referrals of material neglect and supervisory neglect. And so it was just a like we in the history of my career, and probably without the pandemic, we would have never been able to examine something like this. And so this was just a really interesting opportunity to understand how is the time spent at home affecting child abuse and neglect reports. Again, a flawed measure, but in the context of this huge dip, right, we had to get really creative about how we're measuring this. So importantly, we also saw that this relationship between time spent in the home and child maltreatment reports was completely meaningless. There was no relationship between these two variables before the pandemic, right? And we wouldn't have expected there to be. But as soon as the COVID-19 stay-at-home orders went into effect, you see this relationship just pops, and it's very interesting. So. And unfortunately, the data don't allow us to see who's making those reports, because that would be really interesting, right? If they're at home, who's the one reporting these kids to CPS? So unfortunately, we don't know. So I also want to note that sometimes children do not, and they sometimes cannot report their own maltreatment. So maltreatment requires that third-party involvement. So with fewer opportunities for third-party observers, CPS reports might not be the right way to measure child maltreatment. So we thought, okay, if reports from mandatory reporting are down and kids are in their home more often, maybe we're seeing more 911 calls for abuse, and maybe it's coming from neighbors or from family members that are sort of in those, everyone's bubble. Who is in your bubble? And at least in the city of Chicago, we didn't see any significant change in 911 calls for child abuse. So the next thing we thought was, okay, if child maltreatment is still occurring, maybe we're only observing in data the worst cases, like those that are showing up into the emergency department. So in another paper, we used some children's data to look at, which is of course staffed with child abuse pediatricians and social workers. Before I talk about the visits to the ED, what we should know is that kids just stopped coming to the emergency department altogether. Just like everyone, kids also did not come to the emergency department. The one exception is that we actually saw kids coming to the ED for injuries and abuse due to supervisory neglect actually increased. And so what does this mean? This is things like unwitnessed injuries, ingesting poisonous materials that may not have been safely secured, near drownings or falls or gunshot wounds from guns that were not safely stored. So basically thinking about, maybe parents were not, their homes were not equipped for a toddler to be running around, just as an example, and they were, maybe working or, otherwise occupied and couldn't pay as close of attention to their child as they normally would. So, and then the one last thing we did was to scrape social media data. And we did this because so many people were turning to social media to seek community during the early stages of the pandemic. And what we found is that trends in social media posts indicating some sort of emotional abuse increased, but we didn't see any evidence for this for other types of maltreatment. This is also looking at, the older children who are capable of using social media. And again, just looking at broad trends here. But we think this is all, this whole body of work is very important because each of these different measures is going to tell us something different about how child abuse and neglect is being captured and how families and kids are experiencing these particular phenomenon, especially during times of crisis.
Fascinating. Okay, before I wrap up by asking you if there's anything else you wanted me to ask, let me just open it up to those who are online. If you have a question, please go ahead and type it into the chat or the Q&A, and I'll be happy to relay them. I'm not sure if you are able to unmute and actually speak to us if you're online, so typing into the chat is great. And while we're waiting for that, I guess I will ask you, Lindsey, is there anything else that you might want to share to an audience broadly interested in pediatric health?
Yeah, so I think when we think about pediatric health, we a lot of times think about physical health. Maybe we think about mental health, and especially more recently, I think that's becoming much more, the importance of mental health is becoming much more illuminated. One thing that oftentimes gets overlooked is child abuse and neglect. And what we know is that there are very serious and long-term consequences of abuse and neglect that spill over onto many different areas of life. And in the medical field and in medical facilities or in the profession, there are many different ways in which child abuse and neglect can show up. So just as an example, at some point, I was working on a project to sort of, when a child enters the hospital system, how do we screen for whether this child is a potential victim of child abuse or neglect? And there, in my experience, there have been all sorts of challenges with appropriately doing this without sort of creating too many false positives or false negatives. And it's been really tricky. So this is something that I'm also very interested in sort of in the longer term, which hasn't really fit exactly under my more specific niche of public policies. But I think is a lot of potential for medical professionals and those who are in medical spaces to at least be aware of the potential for child abuse and neglect to be presenting, and then also to what to do about it. What are we supposed to do about it? And there are lots of different ways. I'm not going to tell clinicians or anyone else what exactly to do. There are lots of different protocols in place, but I just want to illuminate the importance of child abuse and neglect, and it's something that's oftentimes overlooked when we think about child health broadly.
Thank you. Here's one question. I am currently a medical scribe in an ED that sees both adults and children, and I'm hoping to become a physician one day. What role do you think someone working directly with patients' health in the ED can play in making families aware and be able to access resources?
Yeah, so hospitals and other medical facilities are doing a lot to experiment basically with how they can serve these more social needs, which are, as we know, are in many ways preventive of other longer term, both health and in this case, child abuse and neglect exposure. And so I don't have the right answer for this particular question, but there are a lot of resources. There are caseworkers sometimes in hospitals that are sort of designed to be like, here are the wraparound services that many of our public policies and many of our public programs provide a variety of the resources that families need, and they just don't know about them. So on one hand, it's more of an information sharing, right? There are lots, pamphlets like the old-fashioned way. I don't know what the newer technology pieces are for this, but just getting the information out there and making the applications for programs very low barrier, because this is something that government programs are not particularly well known for. There are also lots of nonprofit organizations that are serving these populations that that are in some ways a little bit easier to access. So I don't have the right answer for you. That's not particularly satisfying, but there of resources, and it's, I think, a factor or a function of getting these families connected with these programs and these resources. And the right way to do that, I don't know. I think there's a lot of experimenting happening in medical facilities, whether again it's with a one-on-one caseworker, whether it's a, sign up through this app and you'll get notifications for various things. All of these different approaches. I'm not sure which one's the best one, but it's really, I think, about information sharing and also making sure that the trust is there for families, because a lot of times they may know of the program or know of the thing that's going to help their family, but they don't trust it, or they don't want to participate because of stigma, or so there are lots of different barriers to getting families access to these resources, and it's going to look different for different populations, and it's going to look different for different types of programs.
Well, thank you. And I think we've run out of time. So first, I want to thank Professor Bullinger profusely for spending your time and giving us some of your insights. I want to encourage the listeners and viewers, if you have a few extra minutes, go and hop on Google Scholar and check out a few of your papers. They really are fascinating and very serious, but also, serious topics, sometimes, I guess, depressing topics, but also super important topics. And so thank you very much again. I'm sure you'd be open to questions if somebody wants to email you, contact you that way. That would be great. And thanks to everybody for attending.
Of course. Thank you all so much for joining.
Take care, everyone.